Thank you for choosing the IPV-HC biphasic impulsator. It is also known as the HC Airway Clearance Device. It was developed by Percussion Air Corporation and Dr. Forrest Bird. For over 50 years, Dr. Bird's products have been used in hospitals around the world. These products have given the breath of life to millions. We believe this unit has set the standard for home therapy units made in the world today. Your HC Airway Clearance Device is portable and self-contained. It will give you more independence, and it will allow you to have airway clearance therapy anywhere and anytime. The control panel on your clearance device has the following parts: zippered storage pockets, a power cord, an on and off switch, quick connect bulkheads, a mode switch. The device also has a biphasic percussion control knob and a fuse holder, corrugated tubing, and a color-coded breathing harness. A two-part breathing head. This includes the Phasitron Duo, which is your mouthpiece with the thumb hole control, and the nebulizer bowl. These are also known as the breathing head and bowl. There is an air intake filter, a platform, a lubrication applicator, a medicine dispenser, replacement fuses and replacement rings for the nebulizer bowl. Before your first session, wash the breathing head and nebulizer bowl. Dishwashing soap and water work well. Let it dry. Find a comfortable place to sit. Have tissues and a clock handy. You will need to time your 20-minute treatment. You can read a magazine or watch television while having your therapy. The idea is to relax during your therapy session. Before using your clearance device, take a few moments to read your manual. You should become familiar with the operation and maintenance steps. Then place the clearance device on a solid, flat surface next to your seating area. Unzip the case so you can see the control panel, but do not remove it from the black carrying case. The device is designed to be used while in the case. The left side of the case contains the attached power cord. Always use a properly grounded 3-prong outlet and the power cord supplied with the device. Never use an extension cord. And never use the device near water or any wet surface. Make sure the unit has 6 inches of clearance from walls or obstructions. This will ensure that the fan covers are not blocked. You will find the parts of the clearance device in a plastic bag. Open this bag and take out the parts. Find the accessory platform. Place it into the slot on the right side of the unit as shown. Locate your mouthpiece assembly, which contains the nebulizer bowl and breathing head. This is also called the Phasitron Duo. Locate the tubing fittings, also known as the breathing harness. These are used to connect the breathing head to the clearance device. They are color-coded. Connect the quick connect fittings of the tubing to the top of the control panel. Do this by twisting and pushing them onto the clearance device. Connect white to white and yellow to yellow. Push the yellow, white, and green fittings on the opposite end of the tubing into the breathing head assembly. Connect yellow to yellow, white to white, and green to green. Note that the red tube connection next to the mouthpiece has been capped. It is not used at this time. Place the breathing head assembly into the accessory platform. Separate the breathing head from the nebulizer bowl by turning counterclockwise. Place your prescribed medication into the nebulizer bowl. For a 15-minute treatment, fill the bowl with bottled water to about 15 cc's. For a 20-minute therapy session, fill it to about 20 cc's. After the bowl is filled, twist lock the nebulizer bowl into the breathing head. Turn the percussion control knob to easy. Select nebulization only phase to begin your session. Turn on the clearance device. Before you use the device for the first time, place your hand in front of the mouthpiece. Feel the dense mist come out of the breathing head. Next, switch to the biphasic stage and feel what the different sensations are with and without your thumb on the vent hole. This vent hole is located on the mouthpiece. You are ready to begin. Switch to nebulization only. Relax in a comfortable, upright, seated position. Put your lips around the mouthpiece and breathe the dense mist. Make sure the aerosol mist does not land on your clearance device. You may want to direct the mist you breathe out farther away from your face to avoid condensation. If so, you can connect the optional tubing to direct the mist away from you. To do this, connect the corrugated tubing to the exhalation hole located on the right side of the breathing head. Relax and continue breathing the mist through the mouthpiece for about 2 minutes. After about 2 minutes, keep the control arrow on the easy setting. Then switch to the biphasic stage. While doing this, keep your lips sealed firmly on the mouthpiece and your thumb off the vent hole. You may be surprised when you first experience the pulsed air deliveries during your initial percussive breathing. This is normal. This allows a series of pulses of air to go deep into your lungs and loosen the mucus. Breathe in and out through the mouthpiece as you would normally breathe. Do this for about 5 minutes. You will feel your lungs being percussed or vibrated from within. Try not to let your cheeks puff up with the percussed air. Your mouth should be sealed around the mouthpiece. After about 5 minutes on the easy setting, place your thumb over the thumb hole. This will increase the sensation, giving you deeper percussions or vibrations. Cover the thumb hole for alternating periods of about 15 seconds to get used to the sensations. Work your way from easy to hard by slowly turning the percussion control knob in small amounts until you reach a comfort level. This will help you cough up your lung secretions. Your treatment period should be from 15 to 20 minutes total from start to finish, and you should have a treatment twice per day. Eventually, you will be able to take a full treatment on the biphasic stage for the entire therapy session. After about 10 minutes of the biphasic therapy, select nebulizer only. Take deep breaths, inhaling dense mist deep into your lungs. Do this for about 2 minutes. You now may turn off the machine, disconnect the tubing, and prepare the clearance device for cleaning and storage. It is important to take a full 15 to 20 minute treatment each time. Don't nibble by taking shorter treatments since this may not provide the benefits of the device. If you have an artificial airway, such as a tracheotomy, you will need a respiratory therapist to help you set up your device. The A50110-HTOPA breathing head is required. The clearance device was designed to be easy to clean. The breathing head should be taken apart and rinsed after each treatment. It is dishwasher safe, or you can clean it with dishwashing soap and water. First, remove the corrugated tubing. Disconnect the breathing harness from the nebulizer bowl and breathing head. To do this, twist and pull straight back on the colored part and not the tubing. Next, rotate the nebulizer bowl counterclockwise to separate it from the breathing head. Clean all parts in your dishwasher or hand wash under your faucet with liquid soap and water. Dry the breathing head by placing it in a kneeling position. shake out the nebulizer bowl. Place it upside down to dry. You should also rinse your breathing harness and corrugated tubing. Hang the tubing with the 3 connectors down. This will allow for back drainage. Make sure all the parts are dry before the next treatment. To make connecting easier, you should lubricate the small O-rings located on the white, yellow, and green parts on your breathing harness after each cleaning. A lubricant is provided with your device. When the parts are dry, store them in your carrying case in a clean Ziploc bag. The breathing head and nebulizer bowl can be stored in the right side of the bag. The tubing and medications can be stored in the front of the bag. Your power cord stores in the left side of the device where it is attached. Keep the bag closed when not using the device. Store it in a cool place. The inlet filter should be checked every 6 months. This can be done by removing the protective cap on the top of the unit. It is labeled. Inspect both filters. Mark your calendar when you begin using the device so you don't miss the 6-month filter check. The filters are easily washed with soap and water. Dry completely before reinstalling. There is also a cooling intake filter on the back of the clearance device. That should be replaced every 6 months or sooner if dirty. To change the filter, remove the set screw from the bottom of the filter guard with a 5/64 Allen wrench. Fuses are located on the left side of the device and are easily changed by pushing and turning counterclockwise when pulling out. Push and turn clockwise to put the new one in. If your nebulizer bowl is not sealing correctly, replace the yellow O-ring which is included with the device. If the device is kept clean and dry, you can expect a 3-year lifespan between mandatory overhauls. However, it is recommended that you have a yearly preventative maintenance check. Please refer to your manual for troubleshooting any problems. When your device is due for its yearly preventative maintenance check, please call 1-800-850-7205, extension 161. Thank you again for your purchase of the HC Biphasic Impulsator. If you need any additional information, please contact Percussion Air Patient Support at 1-800-850-7205, extension 161.